So I had people ask questions on a TikTok about growing up Amish. And since you grew up Mennonite, I thought it might be fun to just go through a few of those.
Go for it.
You down? Okay. You guys were allowed to have photos. So this question doesn't relate to you.
Yeah.
But do you know why Amish? Because you work with, we're actually related. You grew up Mennonite. This is one of my really good friends.
Amish.
And you work with the, Oh,
Beachy
Amish.
Yeah, Beachy
So
Amish.
that's like a really plain.
We weren't allowed to have white dresses or white shoes. Yeah.
Did you do?
No music, no TV.
So basically like New Order Amish a lot?
We had cars.
Were you allowed to have like prints on your dresses?
No,
and stuff?
no prints. We could have a cappella music.
Did you sing hymns like we did? It's similar.
And my mom and dad actually spoke Pennsylvania Dutch growing up, and then like my older siblings spoke it, but then like there was 6 of us, so as it trickled down, some of us quit speaking it. So I was second to the youngest, and I think I spoke it when I was young, and then I just eventually.
But you still know it pretty well, right?
I understand.
I speak it with you occasionally.
I understand about, I think about 80% of what I hear, but if I try to speak it, I can't.
You work with the Amish a lot, so is it getting easier, like as you're around them more and around the language more?
Not really easier. I'll try to say stuff to the little kids that I take care of, because I see a lot of kids and they look at me like I'm crazy.
They're not expecting it.
Like, who is this lady?
Yeah.
Yeah.
But so I was saying, going through questions, because I want to look at the questions on this phone, and then we can look at the
How do I do it? I don't even know how to do it. Me and TikTok. Now my 11-year-old is all about TikTok.
Is he 11?
He's 11 now, but.
Do you follow me?
I think I do.
So.
Now he follows Luann hardcore.
There, it's our live.
There you go.
Oh, thank you, Olivia. Okay, so let's go back through these questions.
Okay, questions.
Traditions. Did you guys have, because you grew up Beachy Mennonite, did you have similar traditions as the Amish? Like, what would be some traditions that? Did you guys have,
how do I do that? Traditions. Okay. Okay, so actually I have lots of cousins and uncles and aunts and grandmas. My grandma was Amish. So we would go and see them for Christmas every year in Michigan. And my aunt, she was single, and she would always have Christmas presents for us, actually. But I remember we would go up there for Christmas, and we would sleep in the basement. And they would have these really nice sheets that were like really cool.
Did they make them themselves?
Oh no, they had the best sheets though. Like I've looked for those sheets my entire life. Me and Gina were talking about that one day. She grew up Amish. They were so soft and silky and cold. Like
I wonder what kind of fabric it was.
Yeah. But anyways, yeah.
Was it old order? Was it old order Amish? Oh, okay.
Yeah.
So, and that was on your mom's side?
My mom's side. And my dad's side.
And that's how we're related, is our mom's side?
No, through my dad's side, and he's from Napanee, Indiana.
Okay. Yeah, that's correct. And that's where my mom's from.
Yep.
Yeah. Oh, that's interesting. So did they have a lot of siblings that were not Amish, that were Mennonite?
So on my mom's side, she had one sibling that ran away, I think, when she was a girl, like a teenager. And then the rest stayed Amish. And then my dad had, I'm trying to think. I can only think of one out of like 12 siblings that completely left everything. And then several of them went Mennonite, which is what my dad did.
So it wasn't a big deal, like when you guys went to family reunions, they were very accepting of you and stuff.
Yeah.
Aww. What kind of things do you absolutely not miss about being Amish for you, Mennonite? What do you not miss?
What do I not miss? You know, that's a hard question because I've gone full circle. So I left the Mennonites, but now I work with the Mennonites again. And I'm 34 years old, and I see a lot of the things that I left because of, and now at 34, the things that I thought I would never miss, I miss now.
I've gone full circle as well. Yeah.
And so I'm trying to think of some of the things that I don't miss.
Well, people were very in our business, like.
Yeah, I think the control factor of like the preachers, just like the fear, that part maybe.
Yeah.
Because you know, you always felt like you're always going to get in trouble if you know, did something.
Do you have examples of things that you thought you wouldn't miss, but now you're around it and you see it in a different light? I can give you an example for me. Yeah. So I used to not like how everyone knew everyone's business. Mm-hmm. But now I called my friend who's Amish, mm-hmm. And told her about my vitamin D deficiency. And I didn't call my mom to update her, but I saw my mom this past weekend and she was like, yeah, Janet's mom, Heidi Mae, called her and it was like, yeah, I heard Louie had a vitamin D deficiency. So it traveled to my mom, not through me. But
yeah, so the family, like the community part of it, I think I probably would have resented that a lot more growing up in it. Like, or I didn't understand. I would say more I didn't understand the community factor. Now, I always wanted to be with my friends. I didn't want to be with my family. I always wanted to be out and about. And now, as I've gotten older, I realize how important family is and how important it is to know where you come from. And going out of your way to go back home to see like cousins and aunts and uncles that you haven't seen in a long time. People that maybe you wouldn't normally, you know, when you were younger have thought was that important or whatever. I think as you get older, you realize that as time goes on, like you appreciate mm-hmm. your roots, I guess. Mm-hmm.
I remember when I was growing up, people would always misenfranchise, mm-hmm. and like we're related.
Okay, so funny story about this. So when I graduated nurse practitioner school last fall, my friend put on a supper for me, and we were sitting at this really fancy restaurant, and all of a sudden I looked around the table and I was like, so there was probably like 8 or 9 girls there. And out of those, I would say probably 60% of the girls were like my second cousins. And so out of all those girls though, I didn't grow up with them.
We didn't even know we were related for the longest time.
Like one came from Illinois and one came from, you know, Indiana. But we found out later that we were related. We were second cousins. Because, well, my dad is a big, and you should totally interview my dad because he's a big, he loves and, you know, doing the whole like climbing the family tree, and he even did a book. So that's how he's able to figure this out. He has a book of like all our ancestors. And
that is so interesting.
Yeah, he wrote the book.
Wow. Yeah, that is interesting. Yeah. But yeah, it is fun to find out. Because, well, and also when we were Amish, we didn't consider like second cousin isn't that close a relation to us. But now, like in the outside world, that's pretty close.
Yeah. Well, and now in my job, second cousins is a big deal.
Oh yeah, I'm gonna get to that. Yeah. Okay. So let's see if anything else is interesting. Do Amish women talk about their pregnancies? So we never did. Did you guys? It was like a taboo subject.
I don't remember them talking about their pregnancies growing up, but I remember that the women always hung out in the nursery. Like there was a nursery in our church. But now the difference between Mennonites and Amish. So I grew up Mennonite, beachy Amish Mennonite. She grew up Amish. They had church in the barn. We had church in a church house.
We didn't necessarily have church in the barn, but we hosted churches at our place. So if it ended up that I had to be in the barn because the house wasn't set up, then it would be. Like,
So you would have had it in the house?
Sometimes if
Really?
yeah.
Well, a lot of Amish have it in the barn.
Mm-hmm.
Yeah. So we actually had a church house, but in the church house they have, of course, this nursery where all the moms go to nurse. But that's where all like the discussions go on about pregnancy and all the things that they don't want us to know about. So yeah, so I don't know. Like I grew up not really knowing. Plus I was the youngest, so like
You wouldn't have.
I never really heard about.
Yeah. Well, we got to the point, because I'm one of the oldest in my family, so we got to the point we could tell if there was going to be a baby.
Yeah.
But yeah, it was a very taboo subject.
Mm-hmm.
What was the biggest obstacle you faced after making the decision to leave? That's a good question for you.
What was the biggest obstacle you faced after making the decision to leave? Makeup and hair and how to dress.
I did not expect that you would go there.
Like
your
yeah.
family, that was a bigger obstacle than like telling your family you're
No, yeah. Because like, you know, when you let your bun down, what do you do with all that? Like,
what do you do?
and yeah, I'm not gonna name names, but there are people that I know that are leaving and they're like, well, we want to leave, but like we don't know what to do with, you know, our hair, and we're comfortable dressing Mennonite. Like we would rather just keep our hair up in a bun because that's what we know, and we'd rather just keep dressing the way we've always dressed because that's what we know. So when I left when I was 19, and I had already started college. That was funny because I was in the middle of my first semester, so like I just left mid-semester, and so in the beginning.
So you went to college when you were still
Mennonite, yeah.
And you were wearing like coverings. Can I see you?
Yeah, I was.
Interesting. I did not know that.
Mm-hmm. I was already in college, and I think mid-semester I just like started showing up with no covering, and yeah.
So you went from like, did the kids?
I wrote an essay about it to my teacher that I was tired of people asking me, what's it on your head? Is it a coffee filter? And she got the biggest kick out of that, and she's still my Facebook friend.
Because Mennonites wear the little fancy.
Yeah.
To me, when I was Amish, I would draw pictures of Mennonite girls with the small little fancy coverings because they were so pretty.
Yeah.
So how did you come to your decision that you were not going to? Just because you were tired of people asking you?
So, okay, what now?
How did you decide that you were going to take your covering off? Obviously, you were uncomfortable with people asking you. What?
It's a complicated reason, and like some of it I can't go into detail. But I knew since I was like 6 years old that I was gonna leave.
You were not scared of like going to hell for leaving?
No.
You did not think that you were, okay.
No. I knew I wanted to leave at a very early age, but I just had to like play my cards right, you know. It had to do with the church I was going to at the time. There was a lot of things going on, and so I just waited till the right timing because I didn't want to get shunned or excommunicated. We don't really, the church I went to at that time didn't really shun, they more excommunicated, which is a little different than shunning. And so I just wrote a letter and basically was like, I can't abide by your rules anymore and I want to go. And I did it at a time when they were distracted with other things that were going on in the church. And so luckily they were distracted and they didn't really notice me leaving, and so I never got excommunicated.
So did your church have like a service where they excommunicated you guys?
They never even like addressed me leaving, which was funny because that's not how they normally do it. And normally they make a bigger deal out of people leaving. I think I got one or maybe two letters from people. Usually it's a big deal. They come talk to you. They beg you not to leave. They will, they make a much bigger deal out of you leaving. But for whatever reason, it was just the right timing. Our preacher at the time was getting removed, and that was helpful in the situation. And so they were distracted with that, and so I was able to make my exit without any like duress. Okay.
So you decided to go to college when you were still Mennonite. That's not a normal thing for Mennonites.
Okay. Yeah. So our family was a little different, and I did watch one of your videos on your TikTok, and your dad kind of reminds me of my dad a little bit. Like, he wasn't the average dad in the Mennonite world. He always told us children that, like, I remember as a young child, him dragging me underneath the house to help him fix a pipe. And he would be like, you can do whatever you want to be. You can be a plumber. You can be a farmer. You can be a construction worker.
Really?
Yeah, and so that's what he told us kids growing up. He pounded that into our heads that we could be whatever we wanted to be. And so I always wanted to go to school. So we typically stopped at 8th grade. So I begged to be able to homeschool for high school, because we didn't have a high school. So I did homeschool for 9th grade. Video. Hated it because I was a social butterfly. And then I convinced them I had to beg to be able to go to 10th grade at a private school nearby. That was a Christian school, which is very abnormal. Usually they do not send you to any schools, especially, you know, a school that is another denomination. Because this was
anyone else doing this at the time?
No.
Or like, how did you come up with that plan? It would have never even occurred to me to think of going
well, I
to
was
school.
super rebellious. I was a very rebellious teenager, and I think my mom and dad didn't really know what to do with me. And I think that they were just trying to figure out, like, I don't know, just like, this girl needs something to keep her busy. And I think my dad was always very reasonable. I don't think my mom would have let me go, but my dad, I think my dad is why I was able to go. I was able to convince them to let me go to high school. And it was a very positive experience, and I graduated and went on to college then.
Right after high school, you went on to college?
Yes, and then I dropped out and had a baby. Yep. As my sister says, that I said at one point in time, shit happens.
Is that what you told him when you got
I don't remember saying that, yeah. But she says that I said that, so yeah, shit happens. Shit happens.
And then you decided to go back to school to become a nurse.
Yes. So my son is what motivated me to become a nurse and to do something with my life. And he is probably the main reason and my main motivation for becoming a better person. And actually, yeah, he is my inspiration for life. So
yeah. So you ended up having another little girl and also becoming a nurse practitioner. Which is where I want to get to with this chat.
Yes.
So is there anything you want to tell me in between, like, going to school and like what you do now? Because that's what I want to get to. What you do now. Making the decision to become a nurse practitioner. Like, was that?
No, I think, you know, there was a lot of things that happened in between, and I think, yeah, everything happens for a reason, and I came full circle, and doors opened. You know, I never planned to end up where I ended up, but doors just seemed to open, and I think God just kind of pushed me through, and here I am today. Because
you run a clinic, is that correct?
Yes.
That you mainly work with Amish.
The population is mostly Amish and Old Order Mennonite.
And you call them plain people?
We call them plain people.
Yes.
And it's about 90% pediatric patients. And most of them have rare diseases. Well, that's what it is, genetic and rare diseases. And yeah, so there's several other clinics like us. There's 2 in Pennsylvania. There's 1 in Indiana. There is either 1 or 2, I can't remember, in Ohio.
Well, there's 1 in Lancaster because I watched.
Yeah, that's where I went to train for 2 weeks. And then there's 1 in Minnesota, and then we're the newest one. And I want to be very careful about what I say. I'm very protective of my patients, so I don't want to say anything specific.
Okay, well, so
but I do want to if there's anybody out there that is interested in genetics, mental illness, yeah, I want to be able to answer questions about those because that's my passion. I'm learning. That's my passion. And I'm amazed at what I've been able to help people figure out so far.
Because you do like genetic testing.
We do genetic testing several different ways. We do lots of different genetic testing. But we've found probably we've opened in December. And since then, I'm trying to think, we have probably found around, probably between 30 to 50 genetic disorders or variants or things that people would want to know that they have. So that's exciting. Well, it's exciting for me to be able to help people. It's not always exciting for them. Like yesterday, I had to talk to a mother about her 2-year-old and her 3-year-old who have a hereditary spastic paraplegia disorder, most likely. And so that's a neurodegenerative condition where they'll end up in a wheelchair eventually. And so, I mean, that's really tough to talk to a mom about that. But, you know, if we don't do it, who's gonna do it?
Right. So. And what it was Amish, the Amish. Mm-hmm. So today when I had been thinking up to today that what you do is because that you work with the Amish and it's like everyone can be traced back to 80 people that started the Amish. And so they have some conditions that are unique to them. Is that correct? Or just show up more in that population?
Yeah, it's the founder effect because it was founded by, you know, the 70 original people. But then because the Mennonites and the Amish keep marrying within, even if they do, let's say, marry out one time. So back to why genetic conditions are really important in the Amish and Mennonite. So because they marry within, they don't really believe in marrying in the outside communities. So they don't believe in marrying outside of the Amish and Mennonite. If they are a carrier of an autorecessive condition, autorecessive means that you have to have 2 copies of that gene to have that disease. So this is where it gets really complicated. I'm not great at explaining this part. But a perfect example would be maple syrup urine disease, and I actually have some patients with this condition. So maple syrup urine disease, you have to have 2 copies of this genetic condition. So if you have, so in the normal population, it's 1, I think in like 180,000. In the normal population, 1 in 180,000 babies are born with this condition. But in the old order Mennonites, I think it's like 1 in like a couple hundred are born with this condition. And it's because they keep passing on these autorecessive
1 in how many did
genes.
you say?
I think it's a couple hundred. I can't remember exactly. So 1 in 180,000 to like 1 in 100.
Does each generation get like more and more?
Yeah.
Like every new generation that comes up?
So actually we're going to do this thing where next month we're going to go out to a community and we're going to be screening a bunch of the young marrieds, and we're going to draw some blood and do panels on them to see what all they're carriers of for autorecessive conditions. And the hope is that if they aren't already married, or if they are already married, that they can just be aware if they are carriers. So what we look for is if they're already married, if they're both carriers of one autorecessive condition. For instance, if they both are a carrier of the maple syrup urine disease, then they know they have a 25% chance of having a child who will have that. Now, if it's a dominant condition, they have a 50% chance of having a child with that condition. So.
Interesting.
So, yeah. So, for instance, if I was to do the this panel on you.
I did some kind of panel.
Yep.
Is it the same one?
Yep.
Okay, I'm interested.
So if something comes up on there, and then let's say we would do it on your husband, and you both would be carriers for something, we would tell you then, okay, this disease, you have a 25% chance. If you would have a child, that child would have a 25% chance of having that disease. So it's a real problem in the Amish and Mennonite because where they keep marrying in and not marrying out, and even like they aren't even like marrying. The problem is they're not even going outside into other Amish communities. They just keep marrying in this.
So like old order
community.
Amish stay with old order Amish, and Mennonites stay with Mennonites.
Yeah, and some of the diseases are even only Mennonite or only Amish.
Interesting.
So, like maple syrup urine disease is old order Mennonite. So like my roots are Amish, so I'll never have a maple syrup urine disease, or my chances of having that are very slim. And then like one that would be common in the Amish is propionic acidemia.
What is that?
It's a metabolic condition that you don't want to have. Yeah.
Interesting. I'm so curious to get my results.
Yeah.
On my...
Yeah. So like, so we also do psychotropic testing, which is really helpful for people who are on antidepressants or are about to be put on antidepressants. So I'm going to use this story because this was really helpful for myself personally. My son has autism and he has ADHD, anxiety, depression. He has a lot of different things. So when he was 6 years old, we took him to a pediatric neurologist, and they started him on a medication called Celexa, which is an antidepressant. And it was to help him calm down and to help him sleep and do all these great things. Well, it didn't do that. And I tried to tell them that, well, instead of taking him off of it and putting him on something else, they kept adding on medicines. So as time went on and they would adjust his medicine, I would tell them, hey, every time we adjust his medicine, it seems like it makes him worse. Can we switch him to a different SSRI? No, they would tell me all SSRIs are the same. So now, 5 years later, now that I'm a genetic NP and I know more, I found out you can actually do genetic testing to see if you have genetic interactions with antidepressants.
Because it tells you like how fast your body metabolizes different things.
Or if you don't metabolize it. Yep.
Yeah.
So I did this on him and found out that he actually does have an interaction with this medication. So, yeah, very helpful. So stuff like that's really helpful, and people within the plain community I have found have actually, they have a lot of interactions to these medications.
More than?
Because of their genetic makeup. Yeah, they seem to, yeah.
So getting that kind of screening does, but because, so I don't remember if it said, it's not just antidepressants that it's testing, is it? It like heart medicine and stuff like that?
Yeah, so you can actually look at the different, some of the different phenotypes, genotypes, and it'll tell you what medications it metabolizes through that pathway. And some of them are heart medications, nausea medications, some of them are antibiotics, antidepressants. So yeah, if people are taking heart medications, blood thinners, like it's really important.
How about, do you come across resistance from the Amish on taking medications?
Yes, yeah, we do. Unfortunately.
Okay, yeah.
Some communities are better than others, and some are, a little more resistant than others, but yeah. But that's okay. I mean, I think like they know like when it comes down to it, when they really have to like get on board, they know like, okay. And it's a kind of a joke amongst like ERs, and actually somebody just told me this yesterday, a doctor just told me this yesterday. They were like, when the Amish come in, they're usually pretty sick. And it's true. Like, everybody I know says that. Like, if an Amish person comes in, you know they're sick. Because, well, number one, they don't have the health insurance. So they're not going to come in unless it's serious. And then number two, they're not one to take medication, or they're just not hypochondriacs.
I ask my friends, because I've been around people that, give their kids antibiotics a lot. And one lady asked me if I'm allergic to any antibiotics. Am I saying it right? And I was like, I don't know. And then I said, I will only take an antibiotics like maybe 4 times in my total life. And she just couldn't believe it. So I was asking Janet and my siblings and everybody if they ever did. And a lot of them never have. And like, there were people that never went to the doctor for being sick. It was very much in our community, you did not go to the doctor unless you were very, very ill.
Well, yeah. That's pretty common, actually. Unfortunately, that leads to some pretty devastating consequences. Like, we see some of our children that we see have brain injuries from birth because they wait too long to go to the ER. So yeah.
Like if they have home births.
Yeah, they have a lot of home births. They do have a lot of home births. Almost all of them are home births.
Like the people.
But I mean, it's just part of the culture. I mean, it's just like it is what it is.
What kind of Amish do you work with? Because I mean, even older Amish, there's some that are more likely to, like the community I grew up in. It was probably 70% of them had their babies at the hospital, and maybe 30. Maybe 60-40 had them at home. But then there's communities that are even like,
I would say it's like 85% have them at home.
Really?
Yeah, it's pretty high.
Interesting. Do they have
but it's a lot more rural out there. I feel like a cowboy sometimes, or like a pioneer in the Wild West when I'm driving
you make
around.
home calls and stuff.
I make home visits. Last night I transported a patient to the hospital.
And you do that kind of, I mean, that's not uncommon for you.
It's not uncommon.
Who pays you for that kind of stuff?
The clinic. Like, I'm just paid like by the clinic. Like, we could get paid mileage, but I wouldn't have to do it. I do it out of the kindness of my heart, but I take my job pretty serious. So like, the patients that I do have, some of them have like organ transplants, and they're very like fragile. So when they get sick, I take it like very, very serious. I don't take it lightly. So I'm probably one of the few providers in the U.S. that's like, we're getting in the car and we're gonna go get a throat culture right now.
But this is how Jolene is, though. Like, if we come to Jolene with a problem, she's like,
we're solving it today.
Right
now. I know. Yeah. And that's just part of my personality. I'm a fixer. There's a lot of things I'm terrible at, but like when it comes to health problems, I get really, really, like my chest gets tight when I feel like my patient's not being taken care of correctly. I don't even know where that comes from, but
she's like, this is what we need to talk about.
This is what's happening.
Yeah. I love that. So, so the clinic pays you, but do you deal with the Amish and paying? Because I've had questions on TikTok about Amish insurance. And I know how our community did it, but do you know much about that side of things?
Oh yeah, so like my dad, you need to interview my dad. He actually started.
Would he be willing to be on?
Oh yeah, he would be. Your audience would love him because he's a.
Okay, I've never actually.
He would know a lot of history about the Amish and Mennonites, but he would have a lot of stories to tell you. But
I would love that.
Yeah, he actually started up a sharing aid for the Amish, and well, not Amish, it'd be Mennonites, and like the churches, it's a cost sharing plan, I guess is what they call it. So I grew up around that, having to hear about that.
Is that what Mennonite insurance? Because since I've been around here, I've heard of Mennonite insurance.
Yeah, that's probably where
And
that
that's
comes
what
from. Yeah, cost sharing.
Oh,
So
okay.
like, yeah. So he has retired from that now. Now my brother runs it. But
Like, how big a thing is it?
I'm not for sure. I mean, I know it's like I don't know, like a couple thousand people or churches.
Do
I don't
other
know.
Mennonite churches do like the Amish, where like in our community, the way that we did it is if there was something that the people couldn't pay for, then the church that they were a member of would throw in, like after church, the preacher would say,
Yeah.
so-and-so needs
Yes.
so-and-so. And then if that didn't cover it, then it would go to the other
Yeah.
churches.
They call that a what is that called? Something offering.
Oh yeah, it is.
Something. Yeah, there's a name for it. They call it. But no, one of my patients said that I have this one community that I go out and see, and they said that it's a very, 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 very poor community, and they have a lot of medical bills and a lot of genetic problems, and one of my patients there has dextrocardia. Look that up. Anyways, so he said that the way that they pay for some of their medical bills is that they will take an offering every Sunday or a certain Sunday, and they'll choose one medical bill to pay on.
Really?
And that's so sad to me.
That is.
I mean,
so
it's
sad.
nice, but it's sad. Like, they can only pay on one bill.
Is it a pretty small community?
And
And also, why would they ask other communities to help?
I don't know.
Interesting.
Yeah, I don't know. But yeah, we really feel sometimes like pioneers out here. Cause like Kentucky, there's certain parts of Kentucky that are not rural, but like all the areas that I've been going to are very like country. So we have to drive a long ways to get to people's houses, and like sometimes we'll just get a letter in the mail from some of these hospitals and they'll be like, yeah, this baby didn't pass their hearing screen. Okay. And so we'll just get in the car and drive out to Timbuktu and we'll go look at this baby. And so, I mean, it's just like crazy. I don't know. I never dreamed in my lifetime I would be doing something like that.
And you're so busy already. The fact that you guys just opened up in December
Yeah.
and you're already this busy.
So 4 months, we went from seeing, 0 to patients. So last month we had 62 patient encounters, which, is a lot because our patients are so complicated. I mean, every single patient like gets the full like amount of attention. So like we've been known to spend 4 hours on a patient when they come to the clinic, and that doesn't even count like all the attention they get after they leave, and follow-up care, and so yeah.
Well, you seem to be thriving. I love to see you in this role because I feel like you're thriving.
Yeah, I love it. I'm excited about the future. I'm excited about helping people, and and it's not just, our clinic is not just for plain people. It's for anyone that wants to come and be screened for genetic conditions or thinks they have a genetic problem or has a child.
Can you be a general practitioner? Considered a general practitioner?
I'm actually a family nurse practitioner, but I am learning and growing in the field of genetics. I'm by no means an expert, but I have learned significantly about this field, and hopefully one day I will be an expert. But the cool thing about this is that even though we do see mostly plain people, it is because these rare conditions are more common in plain people. But we're able to help people all around the world because we are using what we are learning from these children in research and what we know to be able to help other children, the 1 in 180,000, that's out there over in, wherever. So what we do is important because that one child that's over in China might not have a doctor that knows how to treat him, because it's not common over there. So
yeah, that's what I was reading
mm-hmm.
Today. No, listening to the TED Talk today. That's what he was saying.
Mm-hmm.
Yeah.
So like I know in the clinic in Pennsylvania, you know, they have been finding all kinds of like things through their research to help children with genetic conditions, like for SMA and so like gene therapy for SMA. I know right now they're working on gene therapy for MSUD, maple syrup urine disease, which is huge. So gene therapy is the future. I hear they're working on gene therapy for obesity. And I've been looking for a trial to sign up for, and I can't find one. So
interesting.
Yeah, I was like, where are the trials? Because I would totally sign up. So instead, I had to sign up for a personal trainer this week. That's okay.
That's all you.
I'll just do the hard work.
I want to do jujitsu. There you go, jujitsu. No, I can't say it. All right. So how about elderly care? Do you deal with that at all? Elderly care in the Amish?
Elderly care. You know, we did have one that slipped in on us. We try to stay focused on genetics. But one day we came to the clinic, and
so if someone came to you with just like they had a sore throat, like you're not.
We
that
try not to, but you know me, I can't like say no.
Interesting. I didn't know that you were that focused.
No, we try to stay.
Genetics.
Well, in the beginning, you know, I was a lot more lax, but we're starting to journal, so now we're having to be a lot more strict about who we can take. But. Yeah, one day we showed up and it was raining, and this Amish man was standing outside our clinic waiting for us to get there. And he said, "Can you come see my mother? She's sick. She's dizzy." So, you know what we did? We went and saw his mother.
Did he drive to the clinic in his buggy?
No, he hired somebody to come see us. So anyways, she was in her 80s. And we went and saw her, and we took care of her, and yeah. But yeah, I would say I don't really know how the Amish feel about, you know, making sure that their elderly are taking their blood pressure medicine. I don't know. I don't know much about that. I'm curious to know as well, actually.
Yeah, and I'm very curious as well. Like Amish don't have nursing homes. And you don't see Amish people in nursing homes.
Yeah, that's an interesting thing, because all of my aunts and uncles are getting older, including my mom and dad. And it's a really bad problem to have, because I have like 11 aunts and uncles, and they're all just really sad and crippled and falling over and terrible and having surgeries. And I was like, okay, listen. Do I need to just like build a facility and just like stack y'all in there so I can take care of you? I mean, I don't know what to do, because I can't stand to, you know, see them like not be taken care of. But usually the families do, in the Mennonites and Amish, the families do take care of their moms and dads. They just pass them around.
Or like it wasn't uncommon to have a doggy house.
A doggy house. Yeah, we're fixing to do that for my mom and dad, actually.
Yeah, and that's just like an extension.
Yeah.
Like you can put a little section.
Kind of like an in-law suite, except for it's their own house.
Yeah.
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 But what was I going to say about that?
You're fixing to do that for your mom and dad.
Mm-hmm.
Your aunts and uncles are.
Oh, the problem is that when you have single elderly people that don't have children, which is what I have an aunt that's single. So
who is going to take care of her? Well,
she went to rehab, and I don't know. That's the big question. But there's a Mountain View nursing home for Mennonites in Virginia. Did you know that?
No, is that?
And that's also where a lot of Mennonite folk go when they're young to try to find.
No, I did know about that, because that's how my Carlton's mom and dad met.
Yeah.
They worked at Mountain View.
Didn't Roxy go there?
Margie went there and got kicked out.
They kind of do rumspringa on the side, I think.
I think so. Because Marty got kicked out. Oh, that's so funny.
But then people kind of laugh at you too if you go to Mountain View to like work. It's because it's like volunteer work.
Oh, you don't get paid?
I think you do get paid maybe a little bit, but I don't know. It's good work. Don't get me wrong. It's good work because you're taking care of elderly people. But then people, I think, I remember when I was growing up, like people kind of made fun of you because you were going to find you a man or like, yeah. So
I feel like that's a perfect way to branch out of the community.
I mean, maybe that's what I need to do. I don't know. Go find me a man. Anywho.
Aww. Well, is there anything else? I feel like you covered my questions.
I think we did it.
Thank you for doing this, Jolene. I'm going to chat with your dad, mention it to him, and then
You'll like my dad.
Yeah. I've never met him, have I?